Well, thank you all for the invitation. It's really lovely to be here. We will introduce ourselves a bit and then we'll continue with telling what we're doing and where we need you for. I am Emma Paternotte. I'm a resident in education to become a gynecologist. For the next half year, I will be finishing my education to become this gynecologist. And we build a network with all interest gynecologists to focus more on sport in our specialty. And I did it with a couple of persons, but I brought two with me today. So Floor, can you please introduce yourself?
Good morning, my name is Floor Schimmandi. I'm also a resident gynecology, so next year I will be finishing. And I'm very happy to be here and talk to you about sports and female athletes. What we know and what we don't know and how we can improve everything.
Donna?
Yeah, I'm Donna Bootgenrood and same story. So I'm in the end of my education to become a gynecologist. In the past I've been a professor triathlete for a few years. So yeah, the combination of sports and gynecology is really close to my heart, and I'm very happy that I've joined the network, and there's a lot of research to do, so we're thankful for the invitation today.
Is there a possibility that I can switch on my...
Ja. Gaat zo lukken. En ja, de microfoon zit ingebouwd in ons geluidssysteem daar, dus misschien is het handig als jullie aan de rechterkant, dus aan de andere kant van het scherm komen staan.
Ja.
Schuif ik het scherm een beetje deze kant op.
So this is the program of today. Please, maybe it's good that we keep some questions till the end, but if it really can't wait, just say so, but we've got enough time to discuss. But say so if I'm running out of time, or if one of us runs out of time, then we will speed up a bit. So we're sport and gynecology, that's why it's with the I from gyn, you call it gynecology. And we're going to tell you about what we're doing. To begin with, we have a few cases which we see on our outpatient department. For example, this race biking woman, she's 24 years old, and she came to us and said, my last period was 1 year ago. Is there something wrong? Does it have a negative side effects if I don't have any periods anymore? She had a medical history which was blanco, she didn't use any medication, and her BMI was 18. Another case, here we have a track and field athlete of 34 years old, and her question was, I would like to get pregnant. Is it safe to exercise during my pregnancy? We see this question more often since athletes become a bit older, or they train longer, and then they're also in their fertility age. So this for us is a big question at the moment. She also has a blanco medical history, did not use any medication, and had a regular menstrual cycle, which is quite important to know. And her BMI was 22. And case 3, there was a speed skater. She was already mentioned. 24 years old, and as you all know, she said that she was losing a lot of blood and she suffered from her menstruation, so from her period. She had pain and could not give the results she wanted to give. Although she still does very good, I think. But she asked, what can I do? She has a regular cycle, a BMI of 22, and what we're going to do is, this is the starter, and in the end we will tell you what we did with these 3 cases. The goal of our presentation is to get awareness of what we try to build with each other, to understand the relevance of the hormonal cycle of a woman, and we would really like to discuss some research with you, since we are really from the practical field. We work as a doctor, we see these people, but we're just in the beginning of starting research. So I think it's really good to exchange information how we can build this together, for example. So this is our team. We just had a day together where we started with some sporting, and after that we also discussed a lot of things from the sport and gynecology. But the main teams we do now is the individual treatment, as I told you, these cases which I just showed. We do team coaching, so we go, for example, in the evening to see teams, soccer, judo, swimmers, and discuss questions with them without any coaches, without any parents, just we and these sporters. We give education, so we talk now and then on special events. And we just set up some research, and we're planning to do that for a bit more research. This individual treatment is based on the regions in the Netherlands. In every region we have one gynecologist who is focused on the sports. He will see the patient within 3 days and sometimes discuss this in our team if there are main problems. But this is, here you see where they all are. The team coaching, as I just told you, we went, for example, to a few teams, cycling, triathlon, basketball, swimming, judo, and now we just spoke, for example, to the judo team, the Olympic judo team, who really want to focus on this menstrual cycle or the hormonal cycle, and to see if they can improve the results by knowing this cycle or knowing when to train and when not to train. We will explain to this later. We've been to the Team NL day or evening, which was really well organized and nice to meet a lot of people in the field. We give postgraduate education for sports physicians, gynecologists, general practitioners, and also physiotherapists, for example. We have a few research projects at the moment. One is at the TU Delft. They're trying to build an app where they can hold all the information from rowers at the moment. And they do that by asking them a lot of questions, but also interviewing them. And then finally they would like to build an app where they can see what is the best day to deliver to gain the main results. So, for example, they keep on going to register when they have their cycle, when they have their periods, and they know after a few months when they are on their best. And that can help you in training or in matches. Maxima Medical Center is one of the hospitals who delivers a lot of research. Donna is one of them, and she will explain to you this in a couple of minutes. And we have contact now with the NOC-NSF to really focus on research for the Olympic teams, for the various Olympic teams. This is in progress, so I can't tell you much about it yet. I'll give the word to Donna.
Yeah, thank you. So, what already has been told in the introduction is that there is still a big knowledge gap on female athletes and the influence of the hormonal cycle on their performance, but also the obstetric part. So, yeah, there's still a lot of research to do. We saw, and that comes together with the percentage you named, that around 4 till 13% of the research is done on female athletes. The rest is all on male athletes. So there is a big gap, and it's a bit complicated. And right now, it's there's movement, and I think we really need to step into that. I'm part of the research group from the Maxima Center in Veldhoven. They did some research in the past already. That's mainly done by Merel Wieling. She is a sports physician, together with the gynecologist over there. What she did in the last year was a big online questionnaire on around 1,300 female athletes. And basically it was around 600 who were recreational athletes, so around 5 hours of training per week. There were around 600 athletes who were more competitive, so around 7-8 hours. And there was a group of around 70 athletes who were really professional, so with an average of around 15 hours training per week. They made an online questionnaire where they did a lot of questions, and they focused on the menstrual cycle, so the hormonal cycle, and also the perceived influence on performance. What they saw in this group, so the women who were not using any contraception, so the women with a normal cycle, that overall 2.6% had an amenorrhea, so that is an absence of period, so an absence of menstruation. And it was 15% in that small group of professional athletes. And you could see that with decreasing of the BMI, the body weight, you saw an increase of the presence of an absence of menstruation. That is well known already from research in the past, but this was a confirmation basically. And still it's a big number. So for us, there are two sides on it. So when you look at the hormonal cycle and sport, you can say, okay, what is the effect of the hormonal cycle on sports performance? We are more from the doctor side, and we say, okay, what is the effect from sports on the hormonal cycle? So we need to keep those women healthy, and the sports parties say, well, we need to keep those women in the best possible state of performance, and that is where it comes together. I think it's important to look at both. We will always look a little bit more to the health aspect, but also the performance part is important, but they need each other. So you need to have a healthy woman with a healthy BMI to be at her best level of performance. And there comes in the hormonal cycle. So basically, having a hormonal cycle is a sign of a healthy woman who can perform, with our thoughts, at her best. So that's the side. So this is what she saw. She saw that 50% used hormonal contraception, so mainly use of the combined pill, and a part was also using an IUD, so an intrauterine device. You may know it as a Mirena spiral. And she also did a little bit of research about what would you do when you have those periods, those cycle problems. So in case of an absence of menstruation, 50% would say, well, I would go to my GP, my general practitioner, to talk about it, but also a big part would say, well, I don't have any contact about it. I'm just not talking about it. So there are a lot of women having absence of menstruation or maybe an irregular period that we don't know anything about. Then she came to the part of the perceived influence on performance, and as you can see, the blue line, that is the overall group. Orange are the recreational athletes. Those are the competitive, and this is the professional group. And then in the upper part, so in this part, you can see a performed or perceived increase in performance. This is during the period. Now you can see that there is not there's no increase in performance. This is the early phase of the cycle, and then I'll just go to this side of the screen because this is a little bit of base education, but this is the hormonal cycle. We always count day one, so the first day of the menstruation, that is when the women start bleeding, that's day one. Then normally when you have a cycle of 28 days, at day 14 there is the ovulation. So the first part of the phase is called the follicular phase, and that is the part of the cycle where one egg cell becomes bigger and bigger and is preparing for ovulation. And that is the part where you can see that the estrogen, so that is the blue line, is rising with a low progesterone. So those are the two most important hormones in the female cycle. Then around day 14 you can see that you have your ovulation, and afterwards the estrogen is decreasing and the progesterone is rising, and that is where we call the luteal phase. So that is very basic, but it's important to talk you to the results. So she saw that the increase in performance was mainly in the follicular phase, so that is the first part of the menstrual cycle. The decrease, so the perceived decrease of performance, during the period. So that's, you can explain it because the period comes with complaints, but women, they said, well, I just feel worse on many parts, so physically but also mentally. And also a little bit in the phase going up to the menstruation, so the second part of the cycle. That was not very new because we know that already from research in the past that the perceived best performance happens in the first part of the menstrual cycle, so straight after the menstruation. That is done then. What are we doing right now? We have a research group. We are doing at this moment 2 qualitative studies. The first one is the influence of the menstrual cycle on performance, but then we do a really expanded interview. So we have 15 elite athletes, endurance athletes, and we talk with them about 60 to 75 minutes, and we ask them everything about all parts of the cycle, the contraception. Do you use any contraception? Why do you use? Who gave you advice? What do you experience, etc., etc. So we want to know everything about them. It is the same structured interview. We are running them right now, and we will expect results around July. This basically, so it's based in Veldhoven. Venna is leading it. And the other thing is the same procedure, where we also have 15 elite athletes and really elite athletes, so also the Olympic athletes and who have a pregnancy in their career. And we want to know everything about their experiences about the pregnancy, so the obstetric care, but also the training. So how did you adapt training? Who gave you advice? What do you miss? We know that those women still lack a lot of information about sports during pregnancy, and those results are expected in August. So that is what is running at the moment. Then I give the word to Floor.
Thank you very much, Donna, for your presentation so far. So if we see patients in our outpatient clinic, then they have various questions. So on the right you see subjects they talk about, like the fertility, pregnancy, postpartum recovery. So after giving birth, how do I get the fastest back in shape? The urogynecology, so the pelvic prolapse, organ prolapse, and also postmenopausal conditions. We don't see them that often, but yeah, you can also think of that. What we see a lot are questions about the hormonal cycle, and as Donna said before, we try to find knowledge gaps because there are a lot of things we don't know yet, or we only have some limited research, and they are all small groups of female athletes. And if you look at the quality of the studies, then I also talked about with Camille already about that, then the quality is also not that great. So I think we need to have some more research. If you look at the hormonal cycle and the questions they ask us, it's about having menstrual periods. What can I do about it? I will tell you a little bit more about it in the next slides. Because as a doctor, we can give good advice. Hey, you can either do hormonal therapy or not hormonal therapy. But what we don't know is if we give them a contraceptive tablet, how does it influence the prestation or the performance? What we do know from some studies is that if you use contraceptive tablets, that can decrease your amount of testosterone. And as a female athlete, it always sounds a little bit weird, but you want to be kind of like a male. You want to have high testosterone. But if we see that the testosterone decreases, does that also influence your performance? Because is it clinical relevant if it only decreases a little bit? And that's for every woman different, because if you have a lot of problems during your period, then I can imagine that will have a more negative effect than only a little bit lower testosterone. So that's one of the examples. We don't know what is really the influence of the therapy we advise. Other questions, what we see a lot of people with irregular cycle, or as Donna said, the absence of having the period. Contraceptive questions, and also what we earlier talked about, what is the effect of the cycle on performance, and the other way around. If we look at hormones and performance, Don already told you about the basic hormones of the women during the cycle, and I think what is most important for you to remember is that in the first phase, so the first 14 days, your estrogen is high, and during the last 14 days, so the second phase, your progesterone is high and your estrogen is low. And what we do know from research is that if you have a high estrogen, then that increases your anabolic response to exercise. So it's easier for your muscles to grow and to gain strength and to store glycogen. What we also know, and these are also small studies, but you see more and more studies about this subject. I don't know if you also know those studies, but if you are high in estrogen, that you have a higher chance of getting injured. And that's because you have an increase in laxity. So we see during the first phase that, example, for soccer players, you have a higher chance of tearing your ACL. And if you use contraceptives, or contraceptive tablets, that the chance of tearing your ACL decreases. And then if you look at the progesterone, so the second phase of the cycle, it would break down your proteins and your muscles easier. So maybe you can use this to for trainings, for strength trainings. But the evidence is still so limited that we don't have a good advice. Like, do we really have enough research to tell the sport coaches it's very important to do your strength, especially in the first phase? So that's what we want to do research about. And this is what I just said. So in the follicular phase, you have more strength and muscle building. And then if we look at the case, Emma already told you the first one. So we have this cycler. Have you ever heard of red S? Because for doctors it's okay, I see, okay, perfect. So red S is the synonym of relative energy deficiency in sports, and that actually means, well, a long time ago, or actually not so long, because it was 2014, we called it the female athlete triad. And that was the combination of low estrogen, which was sometimes caused by disordered eating pattern, in combination with amenorrhea and osteoporosis. But because it's not only with female sporters, but also for male sporters, they changed the term. So now we call it red S. And it's not only those three things. It's actually the whole. It's actually that you have a low energy availability. So you work out so much that you burn a lot of calories, and you don't eat them enough. So your system is has actually a lack of energy, and that's why a lot of processes in your body are not going well. And so not only for the osteoporosis, but we know that it has a lot of side effects, negative side effects, even for the short term and for the long term. And if you look at the short term, and we see here a list, so recovery is not so fast, but also because you have not so many glycogen storage, your performance is less, your risk of injury increases, risk of getting, I think there is the word illness, so you are faster, you're getting ill, and you have a bigger chance of getting stress fractures. But also in the long term, you have a lot of negative side effects. And for the female athletes, most of the time they don't care, because at that time they just want to perform the best they can, and they don't think about the long-term side effects. But we think as a doctor it's very important to at least tell them about the negative side effects, because we also see the athletes when they are 40 and they have all the negative side effects, and they say, hey, but no one ever told me. If I knew this, then I would definitely have changed something. So I think it's very important also in to tell your female athletes what are the long-term side effects, and the most important and well-known side effects are your increased risk of cardiovascular disease and osteoporosis. Then the second case, so that was a track and field athlete, and she wants to become pregnant. Is it safe? Well, about pregnancy and elite athletes sports, we know quite some information, but also not enough, of course. We never think it's enough because the research we have is done on women, and most of them in the research, the women can play the sport still 90% of her maximum heart rate. And what they did is that they looked at the most obstetric outcomes, the most important. And if a female athlete works out till 90% of her maximum heart rate, you don't have an increased chance of delivery premature, so earlier than that is normal. And you also don't have a chance of getting small babies. We thought in the beginning maybe if you work out too much that your placenta is not functioning well and the babies are very small, or you deliver early, but that's not what we see. But we don't know if the women works out to 100%. Is it still the same? We don't know. And you also a chance of miscarriage, of having a cesarean section, is the same as in female who don't work out until 90% of their heart rate. On the other hand, you always have to be careful with sports during pregnancy, because if you have high impact sports, so sports that can damage your abdomen, of course you have to be careful if you are a field hockey player or ski or a lot of sports like that, because if you fall or you bump your belly, then of course that can damage the baby or the placenta. And the same with acceleration deceleration sports, that can also damage the placenta. So it's not for all sports that it's safe to do during pregnancy. And that's why we try to advise athletes who want to get pregnant. And also the IOC has kind of like a flow diagram with their advice. What would you advise the female athletes in the first trimester, second trimester, third trimester? Weightlifting is also one of the topics we don't know enough about. We do know there's one study who looks at a chance of prematurity, so delivering before the 37 weeks, that if you do a lot of weightlifting, that your chance of delivering premature is bigger, is increased. And then the last one, Jutta, the speed skater in this example, if sporters have a lot of blood loss, you can imagine that they also feel weak because they lose a lot of hemoglobin, and it's just annoying because if you have to change your tampon or whatsoever every half hour, you can imagine that you cannot do your training as the way you want it, or during games or matches. It's just annoying. So we have different therapies, hormonal versus non-hormonal, and we advise the athletes what they can do the best. But we also don't know everything about that, so we also tell them that we don't know what is exactly the effect of using contraceptive pills on performance. And I think it's important to make an individual treatment and choice with every female athlete you see. So then we are almost at the end of our presentation. So the recommendations we have is, if you have female athletes with problems about gynecologist problems, then you can send them to us if they want. We can do a video call, or we can see them in our outpatient clinic, depending on what they want. Irregularities in the hormonal cycle can influence the sport performance, and also the other way around. So sport can influence the hormonal cycle, and I think it's very important to do more research. So that was our last slide. These are the members of our network, so a combination of gynecologists and sports doctors. And this is our website. Are there questions for us?
I was just wondering, as a coach, how can you start with young girls to help them like with their menstrual cycle, and also we know that there's not that much research done. So what do you do? Do you try to change the program or like communicate with them based on the research, or do you first take a look at how are they feeling individually? Because it's so different for everyone. Some people feel really bad during the menstruation, some people feel like don't really different.
Yeah.
So I'm just wondering, how would you like track the menstruation? How do you do that? Do you do it with an app, or is that like too soon on that age?
Which age are you talking about?
Well, it doesn't really matter, but I would say that I would coach probably from 16 years old.
No, that's not too young.
Can you repeat the question for everyone at home, because then they can maybe understand?
Yeah, so there were actually more questions. There was a question like, if you have a young team with female athletes, what is the age you can like talk about the cycle? How do you do it? Do you do it with an app, or do you ask them? Because it's so individual, do you ask them what are your complaints, and can you also adapt your training program to the cycle already? I think that are a lot of good questions. I don't know if one of you wants to answer it, or I will also tell my opinion. Because I think it's very important that you at least talk about it, because what we also know from research, and that's what Donna said before, there are still a taboo about this subject. So a lot of female athletes, they don't want to talk about it, or it's a little awkward to talk about it, so they just don't talk about it. I think if you talk about the menstrual cycle with your athletes, that it gives at least like an opening, and there are different ways of doing it. You can do like a questionnaire, or you can have, as a sport coach, you can ask your athletes in person, and if people don't have any problems with their cycle, I think then you are also done. Then I think it's good to check it every year. But if people do have problems or an absence of the cycle, then I think it's very important to look further and to do more with it.
And to add, it depends a bit on what kind of sports. And I think what we've seen now, that for example in the soccer sports, there we took the whole group together and just talked with all the girls about it. But in judo, they're going to do an individual treatment, so they're going to keep on registering the cycle for 3 months and then discuss it with us. So it depends a bit on what you want to reach. And how you want to do it. So I think we can discuss it with you, or you can discuss it with the team how you want to do it. But open up, this is the first step, and then you can continue.
And 16 is definitely not too young.
No, it's a good age.
And what we also hear from sport teams is that it's sometimes nice if you have different ages, because there's also a question we hear a lot, like I have a young group and an old group, is it awkward to do them together, or is it good to do them together? And most of the time, the older the women get, the easier they talk about. So it's actually good if you have different ages that you put them all together, because then maybe the older one they tell everything about their cycle, their problems, and then the younger ones are, oh, so apparently it's not weird if I have pain during my period, and then they also start to talk about it. So if you have that question, how to do it with different ages, I think what we hear is to put them in the same group, because they can learn from each other.
But you would advise that they start tracking their own cycle before like giving advice based on literature?
Yeah, because it's very important to know if they have a cycle, and
And what you
cannot
said,
give advice.
it is individually based. So we can say for a big group, this is what we would advise, but individually you can focus more on what she needs.
It has to become part of a normal routine. So you have those questionnaires where you check daily, you do a check-in. How did you sleep? How did you eat? How did you recover from the last session? How do you feel mentally? And then in that list, there is a place for the period. It has not been standard, but it has to be there.
Any other questions? So I was quite intrigued by the slide that you showed where you compared performance level with where the woman is in their menstrual cycle, but it was perceived performance level.
Yeah.
So even though that I'm not a woman, for me that's understandable that it's the way it is. Is there any knowledge to what extent this coincides with actual performance level?
Yeah.
Yes, there is.
Yes, there is. There has been done research on endurance athletes and more like power athletes, so power sports and endurance sports. And there is a very broad range of measurements, so VO2 max, voltage, output, but also a muscle biopsy. So they have done quite a lot of things, but a wild variety of performance structures. So it's like a forest with all kind of trees. And there you can see as well that the performance seems to be better as well for endurance as for power sports in that first phase of the period. So mostly between 5 and day 5 and 10. So the early follicular phase. After the period is done, because if you have that serious period, then that is a complication. I would not say that, but that is a problem coming aside. But that is the part where the performance is also better when you measure it. But it is difficult. I spoke with Jos about it. Is difficult to measure it really strict because measurement of performance is always difficult. It depends on so many factors. It can actually be how did you sleep. How did you recover? You have to standardize everything. How is your form of the day? Maybe sometimes you just don't know why I'm feeling better on this day than the next day. So it's always difficult to put it down to one part. So that you say it is because of the estrogen. It's really hard to make that clear.
Yeah, but you would definitely say that there is evidence
There is
pointing
a
to
trend,
that.
for sure. There's a trend. Early follicular phase is the best phase. But there has also been a research that when were Olympic gold medals, when were they had in what kind of phase, and it was during the whole period. So they were won at every time. So there you go. So it is important, but it is not. It is important, but we don't know yet how important it can be. I think.
Maybe it's even more important to know if they're not having a cycle, since this will really influence a lot of physiological systems in the body, and that will influence the performance for sure.
Yeah.
Although these persons also think that they're quite fit if they're not menstruating anymore, since this is their thing. They are light enough to not have a cycle anymore.
As a follow-up question, would you always advise against it, even if it's for a short period of time? Where
No, we would say that if you have a longer, if you have a year or more no periods, then you have a lot of side effects. But if it's less, no, it's not that bad, as we know now. But we know it also from non-sporting persons who have for example, if you have a chronic illness, it's kind of the same situation. You have also kind of red S, since your hormonal cycle is not needed then. Yeah.
And what makes it even more difficult is some women, they have the negative side effects, like the long-term side effects if they have 2 year an absence of their cycle, and other women, they only have the negative side effects if they have it for 5 years or longer.
Yeah.
So it's also very difficult to tell them when exactly their chance of getting the side effects, the negative side effects starts, because that's also individually different, and we don't have a test or a scan or whatsoever. I mean, we can make DEXA scans to see if they have osteoporosis, but we don't have a method to know when this individual patient will develop the negative side effects. So that makes it even more difficult in the counseling.
But you can question yourself if it is, if you are better off having no period, because it is a sign of some processes in the body that are not having enough energy. So it is a sign of that low energy availability, and you could question yourself that I can understand when track and field athletes have to be lean and maybe it's absence for a while, but it is maybe they can be better if they have a small menstruations still, because then I think it's still a sign of that low energy availability. So yeah.
When a patient comes in, has 1 year no menstruation, what is the first thing you're going to do? Are you going to test hormones?
We do a pregnancy test.
Well, a year.
Yeah,
And you don't see many yet.
Still then, we
Very skinny.
it's a fault if we miss this.
Yeah, that's a good question. I think that really depends on what kind of patient you have. Because if it's an athlete, then the chance of having red S is of course much higher than if you have a like obese person. Then we have another
But are you going? I think you are going to test hormones.
Mhm.
Yeah.
And how do you do that?
We do blood tests, blood tests, and most of the times we make an
But you don't
ultrasound.
know in which part of the cycle they are because they don't have a cycle.
That's a very good question. So if they do have a cycle, we always do the blood test on day 3 till 5. But if they don't have a cycle, then it doesn't really matter because then the levels of hormones will be very low anyways. And if you then not have low values, so then that is weird and different than what you think, then most of the time they call you and they say, oh, it's very rare, but I just had my period. So then you test them later again.
We can also make a bleeding and doctor gives them hormones for one time, and then when the bleeding starts you have a 0 level and then you test some blood. But it's not always necessary. But in sports, you make an ultrasound, vaginally ultrasound, and this blood test. Yeah.
Did I understand correctly that in the period 2 weeks before ovulation, that is the time frame where probably there's the best chance of adaptation to strength training, but at the same time there's also the time frame where there's the most
Injury risk.
That's a very dangerous combination.
It depends.
May even lead to self-fulfilling prophecies.
Yeah, you can see it like this, but you can also imagine that these injuries are most of the time, and we know this a lot from soccer players who have knee injuries in their first period of the cycle. But you can also say that if you do straight strength training, this is better for your muscles. But if you have a match, for example, where you have easy chance of getting an injury, this is maybe not a good idea. But this is not a strength training, so I think it's still different.
Yeah, I understand. It's different. But still, it's
It's a
tricky combination.
It's a tricky combination.
explain to your coach.
Yeah.
I think that the bottom part is that we still don't know enough.
Exactly. That's why we're here.
That's your third point, that we need more.
Volunteers wanted.
We need more research. And luckily there are some groups around the world that do that kind of research, and later on we will see that today. But I think this presentation was excellent, just to make awareness for students, just to choose certain projects that are relevant for this, and for the researchers to keep it in mind that the easy way is not always the best way. And the easy way is taking subjects, male, 18 to 25 years old, because they are the easiest to do your research with. But choose the women, just to get more more knowledge about it. So I'm very happy that you're here, and we will. I think we will do our best to help you with your network, and I think ACSS is very well willing to be part of it, in the sense that we, our idea is to bring all sports science together, and probably we can help, or we can help each other.
Yeah, each other. Since if you doing research, we can help you as well, probably with this clinical vision, which we have, or what we see, or from the really hormonal aspect sides.
Because the more you dig in, the more you don't know.
That's true.
So it's good that we are all together.
Do you have plans of the menstrual cycle and performance and injury risk? Do you have plans?
We do have plans, yeah. And the NSA and NSF is supporting us. So we're not yet know what exactly, but there are plans. Yeah.
What type of research would you like to see from the start on? So what is it, qualitative, quantitative?
I think a combination of both would be perfect. Since quantitative research is quite difficult, for example, with the hormonal levels, since we don't know, hey, everybody has a different stage of these hormones, so we can only cluster stages of hormones, but we cannot say 100 is low for this person, 200 is low for that person, so that depends really. But I think we can get more insight in this, so ideally I would check levels with training and combine these two.
Later on today we will be introduced by John Osborne about the project in Norway, and they focus on training and the menstrual cycle.
Yeah.
And that's a very beautiful project, but we will see that later.
But it's a good question, because right now we run those two qualitative studies. For me it was difficult in the beginning because I said, no, I would have data. I want to show them this is what you need to know. But it's really difficult. So we start over here and then we try to find out what we need the most. But we are still, the network is really young. So we are right now also looking in our network, what are the questions, what are the main questions for us, but what can we also do, research that is
fundamental.
Yeah, fundamental, but also where we can rely on. And that's the difficult part.
Do you have an advice or not by asking this question?
I was just thinking about what do you need to track during, for example, training, if you do repeated tests and see where variability is due to day or due to fluctuations in hormone levels, and maybe have some correlations between those.
Yeah.
I was wondering what your ideas on that.
Yeah.
Very good question. Thank you.
I also want to thank you for getting attention for this subject, because I think it will make it easier to talk about it. Finally, more interesting. So thank you. And another thing crossed my mind. Is there any exchange of information about people who have anorexia, who also ask a lot of their body and also have no periods?
Yeah, there is, because for example, the treatment of the absence of menstruation is a little bit, we look at those studies because those are more, and they relate on. So they give substitution to those women, and we do a little bit the same for the women in our category. So there are an overlap, and also because of Red S and anorexia, as they are closely connected. Exactly, they can be closely connected. So yes, there is, but it's all what when I speak for myself, I just look in the literature and I see more information about the anorexia than our group, so we use it. But it's not that it is still combined research at this moment.
But if you look at the groups and the hormonal levels, then they are quite the same. So there will, indeed, what you are saying, there will be quite a lot of overlap.
So there is a correlation between a woman who's not having her period because of relative energy deficiency and someone who actually has an active eating disorder. Their hormonal bill will be the same.
Yes.
Yeah.
Yes. We are in the same category.
Yeah.
So they have low estrogen.
Yeah, right.
And you also have the person who have NRED-S and the eating disorder.
So
that
spot on the
you
spectrum.
have like two circles, and the circles also like cross each other.
That in itself is then becomes that brings it back to being a taboo subject with athletes.
Yeah.
True.
Because as soon as you start putting that Red S name out there, and that gets immediately linked to eating disorders, your response will be, yep, I get normal periods.
Yeah, but I think it's just, so it's important to, because also people with a normal BMI can have Red S.
Yeah.
It's important to tell your athlete that you are working out so much that you just burn a lot of calories, and also if you eat normal, that for her that's not enough.
That's still not enough.
So then you are not saying that she's having an eating disorder, because she doesn't have to have an eating disorder, but she just needs, her body needs more, because you see that all the hormonal processes are stopping.
But it's a very, clinically, that's always a really tricky
It is.
hook to get into,
It is.
since Red S has become such a conversation, and athletes are very aware of that now.
Yeah.
I've found immediately already with our group, they just know as soon as we start to go anywhere towards red S, they'll just say, I've
Yeah.
got normal periods.
Yeah.
And then they don't have to get into that
Yeah.
discussion. So it's a really tricky hook to get
Yeah,
into.
it is.
And separating the eating disorder from the physiological
Yeah.
requirements of a
There
female
are some
athlete.
possibilities to do
is
that. There are some
very
questionnaires
important.
that you
Yeah.
can divide these two,
Yeah.
but still it is
Yeah,
difficult.
it's a difficult click.
And athletes are proud.
When you work with athletes or when you do studies with athletes, don't even use those
Yeah,
terms.
those terms.
Just say this is a study on on female performance or female well-being. And don't use the words red S, eating disorder.
Body
Just
weight.
say it, you
Yeah.
do a well-designed study and you're trying to help them.
Yeah,
Yeah.
yeah.
And,
Yeah.
It all has to do with energy availability. That sounds more nice than a low body weight, for
Yeah.
example, because it doesn't have to be a low body weight. Because if you help those women getting the energy availability better, sometimes it doesn't make a difference in their body weight.
No.
It's just the composition of the intake.
But as an
That's
athlete, you're
important.
afraid to gain weight and
Especially in the ballet.
Especially at the ballet.
And some people are happy having no period because before the period you feel burst, you have some
Everybody
fluid collection.
prefers it. Yeah.
So when you don't have it,
I have a question for Martijn. Are there any questions on the online?
No, we have not. There was a question to show your email addresses again, so there will definitely be going. So I already put them in the chat. So
So yeah, good.
Thank you very much.
Don't hesitate to email. Yeah.
Last question.
Yes, actually two last questions.
very good, that's smart, that's smart.
First, thank you for being very interesting. My first question is about these questionnaires that you mentioned. Of course, we know that a lot of these athletes get questions asked before and after training. How was your training session, so perceived performance, how did you sleep, etc. So how common it is to actually understand the relationship between hormonal cycles and performance with these kind of questionnaires? And is it used today? And if yes, how do you ask these questions? How often?
What I know is that it's still not used in this way for your measuring your period. So I know those questionnaires, and they are all looking at sleep, eating, recovery, etc. So basically, I think if you bring in an expression, but for now, as I know so far, it has not been researched yet. But you can just put it together and have a look from what do you see on the perceived performance.
But I think you mean the questionnaire that we were talking about to differentiate between anorexia and RED-S, or
No,
you
I'm
mean
thinking more general questionnaires. on
Yeah,
sport
but we're busy
performance.
with that now.
you made a questionnaire, right?
For the 200 NOC and SF related top sporters, there is included already a part of the cycle. So there are some questions at the moment who they will answer, but it will be every half year or something. So they haven't seen it yet, but we made it.
And do you think it might be interesting to create some sort of daily questionnaire for athletes, or at least weekly questionnaire for athletes to be able to understand if these cycles impact their performance?
For sure.
Yeah.
Exactly. Yeah.
And how would you ask these kind of questions?
Well, you have a lot of apps. And nowadays, what we understand from these sporters is that they need to fill in every morning what is their heartbeat by getting up, what's their temperature, for example, how did they sleep, how do they feel, and you can ask what is your cycle, where are you in your cycle, do you have your menstruation or not, how do you feel about it. So these kind of questions are already available in the normal menstrual cycle apps. But they're not yet available in the top sport apps who are used by the athletes themselves.
And then as an additional question, you can after the training you can ask how did the training go, and then maybe you see what we think is that if you have the questions in the early phase, so follicular, that if you look at the bigger groups, that you see that maybe the training goes easier than if you have it during the periods or in the last second phase of the menstrual cycle. So it's of course good to know where they are, but then you also have to add another question based on performance. And you have already apps that do that, so that's not only for the female athletes or for the elite athlete, but you have already apps and they have questions, where are you in period and how did your training go.
So with the TU Delft, we now try to develop such an app which all combine these. They are already asked these regular questions, and we try to add some more questions and then make this app available for the athlete sports.
Okay. And what besides this?
Very short. Very short.
I'll come later.
Yeah, we'll do coffee.
Well, first of all, a
very
warm
good.
applause for them.